A rare but painful neurological condition called Parsonage-Turner syndrome is our topic today on Medical Minutes. Texoma Care neurosurgeon Dr. Abdul Baker joins us today to discuss this condition and the prognosis once treatment is applied. Thank you, Dr. Baker, for being with us today. Can you tell us what Parsonage-Turner syndrome is?
Parsonage-Turner syndrome, also called brachial plexitis, is a cluster of symptoms that involve by initially having sharp shooting pain on one side of your arm or shoulder that eventually leads to having significant weakness on that affected arm.
And there are different stages of this condition, right? It doesn't all come on at once. What does that look like?
Pretty much it's classified as acute versus chronic. Acute Parsonage-Turner syndrome manifests in sharp shooting pain that is fairly sudden, and pain is the predominant symptom of the initial manifestation. And the second stage, which is the more chronic stage, manifests in weakness in multiple muscle groups in the arm.
And now, how do we treat something like this? And are there different treatments for the acute versus chronic conditions?
Once you've established a diagnosis, which can be done by getting a specific type of MRI called MR neurography and EMG testing, then you basically treat the symptoms of this condition. This condition is self-limited, and you just focus on treating the symptom. If the symptom is pain, you treat with various types of pain medicine and some anti-inflammatory, and you have to make sure that you maintain the muscle strength by allowing passive range of motion or active range of motion with physical therapy.
Yeah, you have to put in the work with something like this. Now, is there hope for someone who has Parsonage-Turner syndrome?
Vast majority of the patients with this condition recover with significant function, if not full function.
Okay, that is great to know. At least there is some hope if you do get a diagnosis like this. Thank you, Dr. Baker, for being with us today. We'll be right back.